Good morning, everyone. I'm Amanda McMillian, President and CEO of United Way of Greater Houston. I'm thrilled to be with you all today and to welcome you to United Way of Greater Houston's Second Century Vision Funding Conference. For nearly 100 years, United Way of Greater Houston has been working in the Greater Houston region, bringing together and funding diverse partners and approaches to address complex challenges holding too many of our neighbors back from achieving their goals. Several years ago, the United Way Board of Trustees adopted a new strategic vision for our organization called Second Century Vision, which you've all heard about more than a couple of times at this point. In the time since, staff and volunteers have been working to build the foundation to implement this vision. You'll hear more about this vision in just a moment. As part of Second Century Vision, United Way is implementing a new investment strategy, and today is an exciting step in the rollout of that strategy. We hope today's program will offer more insights to you, our nonprofit partners, around that investment strategy and how we plan to show up differently, not only for our community, but also for you as potentially funded partners. Specifically, we really want to more deeply collaborate with funded programs to weave together this network of services to really take our support of families and individuals in need to another level. We believe that when we all work together with intention and transparency, that we can collectively strengthen the network of services in our region to ensure that families and individuals can achieve financial stability and strong, sustainable futures. I look forward to working together to lift up our neighbors and our community. As you can see, we have a full agenda today, and we'll cover all aspects of the application process. We have our volunteer chair of the Strategic Alignment Committee and staff representing a cross-section of our organization who will lead us through the funding process, including a brief overview of Second Century Vision, an overview of our regional investment strategy, description of the application and review process, the process timeline, and additional resources you or your staffs may find helpful as you work on the application. As we move through the agenda, you'll see a visual tracker on the left-hand side that corresponds to the agenda section. We will end today's conference with a question and answer panel to answer any outstanding questions you may have. We have muted mics and the chat feature today, so please submit any questions you might have in the Q&A box throughout the conference. United Way staff will be collecting and organizing your questions in advance of our Q&A panel. I recognize that we have many participants on this call and a limited amount of time, so please know that if we don't get to your question today, we will definitely be updating our frequently asked questions document, and we will have additional sessions scheduled throughout April and into May that we'll be calling technical assistance calls, and those are for you and your staff to share your questions and make sure we get them addressed. Before we get into the details of Second Century Vision, I want to highlight one of the important cornerstones of our vision, which is United Way's commitment to diversity, equity, inclusion, and belonging. And this is our commitment. United Way of Greater Houston joins United Way Worldwide and recognizing that structural racism and other forms of oppression have contributed to persistent disparities that United Way seeks to dismantle. The United Way network strives to engage community members, especially those whose voices have traditionally been marginalized. United Way of Greater Houston works with residents and public and private partners to co-create solutions that ensure everyone has the resources, supports, opportunities, and networks they need to thrive. We commit to leveraging all of our assets, convening, strategic investments, awareness building, advocacy, and others, to create more equitable communities. We have a strong foundation of supporting communities of color through our work, but more strategic, intentional work is needed to remove the systemic barriers to success that so many in our community face today. We will build on this foundation as we lead with our values, work with our communities, and hold ourselves accountable for real change. We stand united with our community to fight for opportunity and equity, and commit ourselves to continue to listen, learn, and ensure that United Way of Greater Houston fulfills the promise of our mission to improve lives and build a stronger community. Specific to our role as a funder, We see our commitment showing up through the following. First, we will be inclusive of community voice. Second, we will counteract institutional racism through ongoing staff and volunteer training. Third, we will use strategic recruitment of organizations with Black, Indigenous, and persons of color leadership. And fourth, we will also execute data-driven investments and funding formulas with an eye toward equity in the data that we use. We believe approaching our strategy and investments with a focus on diversity, equity, inclusion, and belonging will strengthen our impact and help us better serve our community. I now want to turn it over to one of our volunteer leaders, John Gremp, who will provide more details on our second century vision. John is the former president and CEO of FMC Technologies. He is a United Way of Greater Houston board member, and as I mentioned earlier, he's also chair of our Strategic Alignment Committee. He has been deeply involved in our work to implement this exciting new vision for the future, and we are incredibly grateful for his vision and his leadership. And with that, John, I will turn it over to you.
Thank you, Amanda. And thanks to all of you for joining us today and for all you do for the greater Houston community. I'm John Gremp, and I have the privilege of serving on the United Way committee that's responsible for implementation of our Second Century Vision. Second Century Vision is the name of the strategic direction that will guide United Way of Greater Houston's second century of service. Our vision for the second century is to create the opportunity for individuals and families in the greater Houston community to thrive. We'll do this by leading, serving, influencing, and convening the nonprofit social services sector to deliver quality services with exceptional outcomes. Ahead of the funding conference today, the United Way team has provided information on the Second Century webpage for potential partners to learn more about this funding opportunity. From United Way's homepage, you can click on Second Century Vision or go to unitedwayhouston.org/SCV. And there you'll find more resources and information, including a recording of today's funding conference after it concludes. In order to ensure we are using common terminology and to share key components of Second Century Vision, United Way staff have prepared several modules on the following topics: Upskill 101, Coaching, Collaboration, ALICE, and Continuous Quality Improvement, or CQI. We've also created an Upskill module resource vault where you can find additional information and resources. We strongly encourage your staff to view each module in advance of working on the application. The modules can be accessed free of charge via the Second Century Vision page on unitedwayhouston.org. As you saw a moment ago, our vision for the second century is to create the opportunities for individuals and families in the greater Houston community to thrive by leading, serving, influencing, and convening the nonprofit social services sector to deliver quality services with exceptional outcomes. With thrive meaning individuals and families attain sustainable quality of living through access to an integrated, journey-based experience. Let's look at the key principles of that strategy. We'll start with the who. Moving forward, we will be focused specifically on serving individuals with household income up to and including the ALICE survival threshold, which as of 2018 included 47% of our population in the greater Houston area, an increase up from 40% in 2016. Now, obviously, this number does not yet take into account the effects of the COVID-19 pandemic, and we anticipate that that number will increase even further. ALICE stands for Asset Limited, Income Constrained, Employed, and is a way of identifying those who earn more than the poverty level, but not enough to make ends meet. For more information about ALICE, please visit unitedwayhouston.org/ALICE. Now the what. Our strategy aims to provide families the opportunity to attain a sustainable quality of living through the following. First, financial stability that is supported by early child and youth development through out-of-school educational opportunities. Second, access to healthcare with a focus on behavioral health. And finally, safety net services, which include things like food, housing, and escape from violence. The where? Our region of focus has not changed. We'll continue to serve the 4-county Greater Houston area, which includes Fort Bend, Harris, Montgomery, and Waller counties. And finally, the how. Second Century Vision will be realized through transformational change to how we approach our work, including an integrated approach to service delivery and a coaching framework. This integrated approach and coaching framework is key to developing an integrated client journey that drives client success in achieving their goals. The focus areas are having the right agency expertise connected, integrated coaching and client support, and having a client journey tool and resource map. We'll discuss each of these more as the conference continues. On the right, you see an example of what it might look like when these areas of focus come together. Rather than working in parallel, programs are orchestrated to allow the client to engage across services as needed. Under Second Century Vision, United Way will partner with agencies that provide programs that address client needs as they move through their journey. To talk more about that, here's Margaret Oser, who will share more on the regional investment strategy and services.
Thank you, John. It's been such a pleasure to be able to work with you side by side as we develop Second Century Vision. My name is Margaret Oser, and I am Vice President of Mission and Strategy at United Way. We appreciate you being here today to learn about Second Century Vision and United Way. During my time with you today, I want to talk about services that will be eligible for funding in our regional investment strategy. Funding is available for the provision of one or more services specified under Second Century Vision. Funding will be invested within 3 categories: safety net services such as basic needs and freedom from violence, integrated services such as financial stability, early childhood and youth development, and health and behavioral health services. And finally, navigators serving the integrated client journey. To provide more context for what that looks like in practice, here are some examples of services. The integrated client journey includes both safety net services and integrated programming, as well as navigators working within the integrated client journey. Safety net programming includes basic needs, services such as rent, mortgage assistance, utility assistance, technology access, food, shelter, and transportation assistance. And freedom from violence, which are immediate short-term services focused on safety for those fleeing domestic violence, human trafficking, or vulnerable populations such as refugees. Our integrated services include financial stability programs such as vocational training and employment coaching, financial coaching and training, and safe, affordable financial products and services. Early childhood and youth development programs include early childhood education, childcare, out-of-school time programming, college and career readiness programming, and parent engagement. And finally, under the integrated services, we have our healthcare programs. These include primary and specialty healthcare services and behavioral healthcare services. And lastly, we have navigator services, which you will learn more about in a few minutes. As part of Second Century Vision, we have established 13 priority regions for investment. Regions were identified across our 4-county service area based on the density of population with incomes ranging from 0 to the ALICE survival budget threshold, and the density of BIPOC, Black, Indigenous, persons of color, as recognition of historically disproportionately impacted populations. Currently, there are 8 regions within Harris County, 2 regions within Fort Bend County, 2 regions within Montgomery County, and 1 region within Waller County. A searchable database of each region by zip code is available on our website under Second Century Vision. Funded partners must have a presence in and provide services in one or more of the 13 priority regions. Now that we have described the types of services and geographic locations that will be considered for investment, we want to provide more information about how our investments generally work at United Way. Those of you who are familiar with United Way know that our investments are dependent on the generosity of donors who contribute to our annual community campaign. We engage in ongoing stewardship to ensure those donated dollars are invested responsibly. Our community investments are backed by research, made by trained volunteers, and ensured by good stewardship. The annual community campaign fuels our work, and we invest more campaign contributions, dollar-wise, back into our community than any other United Way in the country. For Second Century Vision, funding will be awarded for up to a 3-year commitment as results-based flexible funding and is subject to performance and/or available revenue annually throughout the funding cycle. This means we won't be prescriptive in how you spend the investment dollars, but you will have to show impact for the programs for which you are applying. Although we wish we could tell you how much is available for investment in each region, we won't have those amounts until late in the fall of this year based on our community campaign. Our investment strategy for Second Century Vision includes first determining how much will be invested along the integrated client journey program components within the region based on the density of the Alice and below population, BIPOC, and service gaps and needs within the region. For agencies that are awarded funding, please remember that we cannot guarantee set funding for the duration of the grant period. As you have no doubt experienced, giving can shift based on a variety of factors. In those situations, we may need to adjust investments on an annual basis throughout the grant period. Now, to address one topic that we are asked about frequently, the minimum and maximum amount of funding. It has been determined that funding amounts will generally be between $100,000 to $2 million per agency. This is dependent on the scope of work and the agency's budget size. We want to do our best to ensure the full suite of Second Century Vision services within each region. As a result, the maximum funding amount will not be awarded to a single agency in one region. We encourage you to utilize the regional map data to help inform your funding request for each program in each region. For example, if you are focusing on a region with a sparse population and a high number of services, you may consider requesting a lower amount, versus a more densely populated area with a lack of services, where a higher amount may be warranted. Remember, the amount of investment available in each region is based upon households with annual income between 0 and the Alice survival budget, BIPOC, and the additional service needs data. Your funding request should match the impact you intend to achieve. And although we don't want to discourage dreaming, we ask that your request be realistic. Please note that $2 million awards will be the exception, not the rule. If needed, as you advance in the funding process, adjustments to requested amounts may be discussed. Based on the investment for each region, we determine how much of the regional investment goes into the integrated client journey. Here you see a dumbbell dot plot that depicts the bottom and top percentage range for each area of the integrated client journey. The yellow dot reflects the bottom percentage, and the blue dot reflects the top percentage. For example, we anticipate investing anywhere between 35 and 40% of a region's total investment into financial stability programs. And we anticipate investing between 13 and 15% of the region's total investment into healthcare programs. The range is based on the need and demand for services within each region for current data available, such as ALICE, demographics, 211 data, and various community indicators. Again, we share this with the intent to assist you in determining your ask should your agency decide to request funding from United Way under Second Century Vision. As mentioned before, our available investments are based on our annual community campaign results. There may be situations where we may award partial amounts. With this in mind, we invite you to be thoughtful in your request. Now I'll turn it over to my colleagues, Becca Fritze and Traci Jack, to talk with you about United Way's requirements for funded partners.
Thank you, Margaret. My name is Becca Fritze. I'm a manager on the mission and strategy team. My colleague Traci Jack and I will review the requirements for funded partners. As John mentioned earlier, a critical success factor for Second Century Vision will be using an integrated client journey that allows a client to create their own customized pathway based on their goals and needs. Rather than working separately to address individual needs, programs are coordinated to make it easy for clients to engage across services as needed. As a reminder, these services include financial stability services supported by physical and behavioral health care, early childhood education, and youth development, all supported by safety net services that help people take care of their basic needs, like food, shelter, clothing, and other critical needs. A navigator is a role within the journey that uses a relational, strengths-based approach to help clients articulate and achieve their goals. The navigator won't tell a client what to do, but will help guide a client along their individualized journey and connect them to services along the journey through referrals and utilizing relationships to make a connection to those services. Navigators follow up to ensure that the client did indeed receive those services. It is intended to be a long-term approach to working with clients. There will be at least one navigator located in each of the 13 regions in the initial launch in spring 2022, and organizations may apply to house a navigation team within their organization. We will share more about how to apply for this a little later on during the application process. Not all individuals receiving services in your agency or program may be ready to begin on the integrated client journey, but the intention will be to help identify those that are ready for multi-step services. You may ask, what does the journey look like in practice? United Way has been running various pilots this past year to test this approach out. Here is one real-life example of an individual who came to United Way Bay Area Service Center and worked with her navigator, Evelyn. The client, we'll call her Mary, came in seeking a job as she had been laid off. Mary had very little savings and was struggling with motivation and confidence as she hadn't been able to find employment for some months. Mary used to be financially stable and would always donate to organizations in need. She never thought she would need to seek assistance, and at first she felt embarrassed about seeking out assistance. Her navigator, Evelyn, helped Mary to define her goals and also let her know that it was okay to ask for assistance until she can get back on her feet. Evelyn was able to refer Mary to a food pantry where she received food assistance. After receiving food, Mary felt so proud for following through with the referral and expressed how grateful she was for getting connected with the food pantry, which allowed her to stretch her savings. Evelyn also provided Mary a referral to an employment coach who assisted her in updating her resume to reflect demands and skills for the current job market. Mary also got a referral to a financial coach so she can continue to work to stretch her savings as much as possible by creating a budget. Along her journey, Mary was able to schedule a few interviews, but she lacked professional clothing. Her navigator, Evelyn, referred Mary to an organization who provided her with suit and shoes for an interview, and also connected her to an organization to help her get a gas card to get to the interview. During this time, she had a health concern that needed immediate attention, but due to limited income, she couldn't go to her previous doctor. She was able to connect with a community health clinic that immediately scheduled her that same afternoon. She was able to get those health concerns resolved and make it to her job interview. Mary was hired, but due to the economic downturn from the pandemic, just 2 weeks later, she was laid off. She shared with Evelyn that she was feeling depressed and not confident in herself due to being laid off once again. Evelyn connected her with mental health counseling services. After several counseling sessions, Mary expressed that it has helped her and she'd like to continue with therapy. As of this past month, Mary gained full-time employment with the opportunity for a raise within 90 days and the potential to move up the career ladder in the future. Mary was able to overcome many challenges in her path with her navigator, Evelyn, walking beside her and supporting her towards her goal. This is just one example of how a journey may look in practice, but each client's journey will be unique and personalized. As a reminder, ALICE stands for Asset Limited Income Constrained Employed, and you heard John speak earlier about who ALICE is. If funded, it will be expected that you will primarily serve individuals and families whose annual income is between $0 and the ALICE survival budget as part of your funded programs. Here are some more details on how you'll be expected to identify and serve ALICE. First, income will be assessed at the time of intake or entry, as we understand that someone's income may go up while they're in the program, and it will only be required to be self-reported. You'll be tracking gross income, which is pre-taxes, along these income brackets on the screen as set forth by the Kinder Houston Area Survey. We define household as all adults and children that are living together and hope that this recognizes that a household makeup or how someone defines a family can look a lot of different ways, and therefore their survival budget changes based on that household makeup. We ask that you primarily focus on ALICE in the program or programs you are applying for, and this will be a part of the evaluation process to determine funding for your program. However, we will work with funded partners to take a client-centered approach to this data collection. We would never want you to limit someone from receiving services if they are close to the ALICE threshold or have unique needs or circumstances. If funded, more support and even further details on how to track income will be provided, and we will work together to develop best practices on how to have a conversation with an individual to best capture this information. Please visit the ALICE page on the United Way website or the ALICE module in the Upskill trainings for more information on ALICE. Collaboration is a key component of service delivery under Second Century Vision. We define collaboration as a group of organizations with a common interest who agree to work together towards a shared goal, which will be working together to help individuals and families to thrive. If funded, it will be expected that you collaborate with other organizations on behalf of ALICE families. Some of the expectations for collaboration include participate in and seek opportunities for collaborative programming, demonstrate commitment to the best interest of the populations being served, actively seek ways to scale services through innovative partnerships, advance the integrated client journey by working towards a common goal. So by, for example, receiving referrals from the navigator or navigators in your region. Leadership, commitment, and buy-in, as we understand that, is integral for allowing collaboration to happen. And when appropriate, having formalized agreements between collaborative partners. United Way will help support in fostering collaborations between organizations, and there will be opportunities to connect with other organizations through peer learning communities, which we will discuss next. Please visit the collaboration module of the Upskill trainings for more information on what United Way means by collaboration. You can also reference our standards and policies document that will be shared more on in just a moment and can be accessed on the Second Century Vision page of the United Way website. As part of the commitment to collaboration, it will be expected that you attend and actively contribute to an assigned professional learning community, also known as a PLC. A peer learning community is a group of professionals that come together with a common goal to share best practices, resources, and provide support to each other to better make an impact on ALICE. These are just some examples of peer learning communities that may be available under Second Century Vision. United Way will lead and convene these PLCs, and they may be focused on issue areas such as financial stability and education, regional peer learning communities based on the region you provide services in, navigation for those who are navigators, or a coaching network for those providing coaching services such as workforce and financial coaching. We will provide more details once you are awarded funding on how often these PLCs will meet. Our hope is that if awarded funding, you don't only just attend these meetings, but your voice and your ongoing input will help shape the future of these peer learning communities. I will now transition to Traci Jack, who will share more on capturing data within Second Century Vision.
Thank you, Becca. My name is Traci Jack, Senior Director of Strategy and Analytics. A cornerstone of Second Century Vision is the transformational way we intend to use data. We envision using data in real time to support the integrated client journey, to inform continuous quality improvement, to better understand the client service needs and impact of services upon households with annual income between $0 and the ALICE survival budget. How we use data will evolve over time, and funded partners will collaborate with United Way through data sharing. All funded agencies will be asked to report on a common set of metrics that will help us better understand the impact of services and client-level progress along their journey. A list of the common metrics will be available on the Second Century Vision webpage after the funding conference. Funded partners will be asked to submit quarterly reports and will have support from their designated United Way liaison. We created a logic model to show a visual representation and to better articulate the common metric structure. Our purpose and assumptions are that a huge demand exists, with 47% of households struggling to make ends meet. This was before COVID-19. We know that it's likely much more. Critical to meeting the demand is to accelerate impact as need continues to grow, to integrate programs in order to serve Greater Houston more effectively, define data needs, measure and apply towards impact, and continue to raise funds to drive impact in the community. The inputs or resources we'll need include you all, community partners, nonprofit, government, etc., community volunteers and stakeholders. Our 4-county service area divided into 13 priority regions, and households with an annual income between $0 and the ALICE survival budget, to name a few. The work we do with our inputs are tied closely to the common metrics. Activities include services along the integrated client journey through financial stability, early childhood and youth development, healthcare, freedom from violence, and basic needs. Additional activities include tracking and measuring data along the integrated client journey and leading and convening collaborations among partners. We've included the key elements for inputs and activities in the logic model, but it is not exhaustive. Next, we move into the common metric structure. We envision a variety of outputs related to volume of work, short-term, intermediate, and long-term outcomes, and indicators that will lead into the common metrics. Funded partners will have technical assistance through assigned liaisons for identifying what data will be measured and reported under the corresponding metric to their services. We have 4 integrated client journey metrics that measure the progress of the client along the way, such as United Way will foster and support coordination between agencies in the journey to ensure services are accessible to clients in a timely manner. United Way will support the creation of trusted data sharing practices within the journey. United Way will support partners and programs in being versatile in order to meet community need in real time. And United Way will support agency partners in creating a journey experience that is client-driven, accessible, and personally successful. Those metrics lead into service performance metrics, which measure the success of a particular safety net or integrated service. For example, financial stability, people increase their income, savings, and acquire assets. Early childhood and youth development. Youth demonstrate college and/or career readiness. Healthcare. People engage with healthcare and/or behavioral healthcare. Freedom from violence. People increase their safety. Basic needs. people meet their basic needs. Our logic model depicts how our collaborations across regions and the integrated client journey will lead toward creating opportunities for individuals and families to thrive. Data collaboration will occur through the development of a data trust agreement. This legal, technical, and governance framework will allow United Way and its funded partners to better align and coordinate service provision, enhance measurement of client impact. It will allow each partner to maintain ownership of their data and how it is accessed and used, and ultimately allow the network of funded partners to be responsive to emerging opportunities. Also, United Way is exploring the development of a cloud-based technology tool that will support data collaboration across all funded partners. This platform will adhere to all data security concerns and regulatory requirements. After executing the data trust agreement, funded partners will be able to upload agreed upon client level and aggregate data into a master resource database. The database will support continuity of care between service providers and allow agencies to run analytic reports in real time. This platform will not replace any existing technology used by your agency. Standards and policies formalize the relationship with United Way and what it means to be a funded partner and our expectations. These are newly revised standards and policies as part of our new vision. Organizations selected for funding will have to agree to these standards and policies. They are available on the website at www.unitedwayhouston.org/SCV. Next, Melinda Garcia and Curtis McMinn will review the single investment funding process.
Thanks, Traci. I'm Melinda Garcia, Director of Community Outreach. Curtis and I look forward to walking you through the eligibility details and overview of the new investment process. We know that there is a lot of interest in receiving funding as part of United Way's new second century vision. However, to qualify, an organization must meet our eligibility criteria. An organization must be a 501c3 designated nonprofit that has had that designation for at least 3 years. The organization must meet the minimum requirements of 3 board members who represent the local community, meaning they live in United Way's 4-county service area. If you are a national organization, there must be a local board that meets this definition. You must have the appropriate insurance to cover your board of directors, liability insurance, and any other service-specific insurance that is necessary for your programming. You must provide services that align with our definition of what we're looking to fund within the service categories of safety net, integrated, and/or navigation services. In order to apply for a specific region, the agency must have experience working within that region or have specific plans to provide services within that region. In addition, you must meet United Way's focus on households with annual incomes between 0 and the ALIS survival budget, and meet organizational review requirements, which are listed in the funding announcement and in the new standards and policies. Here's the timeline of the application process. The application goes live today. You have until May 4th to submit for early submission. Early submission gets you some high-level feedback that can then be incorporated into your final application. The last day to submit all applications is June 7th at 11:59 p.m. Application submissions will not be accepted after that time. Because applications are submitted online, we urge applicants to submit earlier than the deadline in case there are any connectivity issues or help is needed. Once the application is submitted, United Way staff and community volunteers will begin screening the applications to determine whether they meet the minimum standards and align with our vision. We will also begin the organizational review process at that time. This is known as Phase 1. By the end of July, applications that meet the minimum qualifications will receive a notification that their application is moving forward to Phase 2. Applications that do not meet the minimum qualifications will receive notification that they will not be moving forward. Due to the volume of proposals we expect to receive, these decisions are final. However, if not funded, your organization may still reapply for future funding opportunities with United Way. Those applications that are clear to proceed to Phase 2 will get a further review by staff and the community volunteers. United Way staff and volunteers will then interview each agency to discuss their application and ask follow-up questions. We will then make a funding decision based on information gathered each step of the process, United Way volunteer and staff input, and any other available resources. We expect to make notifications of funding in January 2022. The onboarding process begins at that time. We will then devote January through March 2022 to helping organizations prepare to begin delivering services as part of Second Century Vision. Funding and services will begin April 1st, 2022. And now I will hand it off to Curtis.
Thanks, Melinda. Hi, I'm Curtis McMinn, Senior Manager of Mission and Strategy. So let's talk about the application process. Although we're wanting to fund services in 13 regions, each agency will only have to complete one full application. However, there will be questions for each of the 13 regions. If you wish to apply for services in more than one region, you must complete each region's questions to be considered for funding. Your overall request will need to communicate how much would be devoted to each region you are applying for and any other resources outside of United Way's award. The great news is that you can apply to provide services in multiple regions, but that is totally up to you. To be clear, many will say that they serve all of Houston and people come from all over to access their services. This is not what we mean by serving in multiple regions. To receive funding in a region, you must have an existing or anticipated presence in and provide direct services to residents in each region for which you're seeking funding. By serving in a region, we're expecting funded partners to be engaged in that region and participating in any applicable learning communities or training associated with that region. Finally, you are able to apply for multiple services within a region. As an example, you may want to apply for a utility assistance program under Safety Net and also a counseling program under Integrated. You will not be required to offer the same services within each region you apply for. So for instance, you may want to apply for that utility assistance program and the counseling program in Region 1, but just the counseling program in Region 4. United Way is a volunteer-led and driven organization. Volunteers are critical to the work we do and provide valuable input to our decision-making process. As part of Second Century Vision, we're expanding our work with volunteers in the investment process. You'll see here that we're prioritizing volunteers from the following list. 1, we think it's vital that ALICE and those living below the ALICE survival budget have their voice represented in the investment process, including targeted outreach to volunteers to review applications for services within their specific region. 2, we want to diversify our volunteer teams to reflect the communities that we serve, with targeted outreach to people of color. 3, we also want to work with volunteers who are United Way donors that are passionate about serving our community and also have some experience volunteering or working with nonprofit organizations. Finally, we continue to screen for conflicts of interest and biases in our volunteers so that you can be confident your application will receive a fair and objective review. As you can see here, we've outlined that in both phases of the application process, a cross-functional group of United Way staff and volunteers will be reviewing and providing input on whether an application receives approval and the amount of funding that's awarded. We'll now transition to Lindsey Hill and Angiela Zielinski to discuss the application and evaluation process.
Thank you, Curtis. Hello, everyone. My name is Lindsey Hill, Manager of Mission and Strategy. Angiela and I are extremely excited to talk with you today about the application your organization will complete should you decide to apply for Second Century Vision funding with United Way. The application includes two components: organizational review and application questions. As part of your application process, all agencies, both currently funded and new agencies, will undergo a review of their organization's governance and financial health called Organization Review. Your agency will be asked various questions and prompted to upload documents pertaining to your agency's governance and finances. In addition, our team has developed a series of application questions that will allow you to not only explain who you are as an organization, but also provide in-depth details regarding your current impact in the community and discuss the basis of your funding request. We encourage you to review the application in its entirety with various members of your team so that your agency's work and plans are communicated in a thorough but concise way. Now let's briefly review the application. It is divided into two parts: agency level and region level questions. The application provides an opportunity for your organization to introduce itself and help the reviewers understand your ongoing efforts to serve households with annual income between zero and the Alice survival budget, and BIPOC, as well as agency efforts related to diversity, equity, inclusion, and belonging. We've also provided space in the form of scenario-based questions to explain your agency's approach to working with clients along the integrated client journey. With CQI still being a major component of United Way's work, reviewers want to know about your CQI culture and commitment to measuring common metrics. In addition, the application provides an opportunity for reviewers to better understand the following: regions you intend to serve, the services your agency proposes to offer within these regions, your current experience or plans to serve clients within each region, amount of funding requested, and how dollars will be used. The application is dedicated to understanding your agency's staff capacity to deliver quality services. The final section, which will only be completed by agencies seeking funding for navigators, which will be discussed by my colleague, Angiela Zielinski.
Thank you, Lindsey. My name is Angiela Zielinski, and I'm the director of the United Way's Nonprofit Connection. Earlier in the presentation, you learned about the client navigator, who's a professional who uses a relational, strengths-based approach to help clients articulate and achieve their goals. Navigators use essential referrals and support to clients as they move through their journey to financial stability. Navigators can be described as empathic, compassionate, non-judgmental, motivating, and encouraging. More specifically, navigators are generalists, not specialists. What this means, for example, is that special populations such as survivors of domestic violence, individuals with intellectual or developmental disabilities, and seniors will engage with a navigator who does not specialize in any of those areas. Rather, the navigator is able to help clients set and achieve their goals, regardless of their presenting needs. Navigators work alongside an agency's case manager, coach, or counselor. But navigators are neither case managers nor counselors. They use a relational, strengths-based approach and connect clients to services across the integrated client journey. They use coaching skills to help clients articulate and achieve their goals. They have the ability to deal with clients in crisis and resolve conflict. And they must work with diverse populations. In order for navigators to successfully work with special populations, they will receive extensive training in coaching skills, trauma-informed care, cultural humility, motivational interviewing, cross-cultural practice, the use of common tools, among other topics. Because clients live in communities, navigators are aware of the strengths and resources of the specific community they are serving. Navigators work within a navigation team at an agency. The navigation team will include the navigator, who works full-time on navigation duties, as well as staff members who are partially assigned to direct service navigation duties and supervision, so that the agency can serve clients without interruption if there is staff turnover. We will build 20 navigation teams across the 13 regions described earlier. Investments of up to $100,000 are available for each navigation team. Each agency may only request navigation funding for up to 2 regions. While a navigation team is housed at an agency, the team must serve clients in the entire funded region. Agencies must assign a minimum of 1 full-time navigator, a portion of other staff members who will act as a backup to the navigator, and a portion of the supervisor to the navigation team. Allowable expenses include the navigator salary, benefits, cell phone, supplies, laptop, mileage, and the pro rata share of backup staff salary and benefits, and the pro rata share of supervisor salary and benefits. And finally, agencies may apply for the navigation team investment only if they wish. While agencies can apply for navigation team investment only, you must access this section of the application through the general application. The questions will include a description of how the navigation team fits into your overall organization and programs, how your agency has served or desires to serve the region, where and when clients would have access to navigation services, what are the characteristics of your ideal navigator for the regions you propose to serve, how your navigation team will be composed, including title and job functions, how you manage navigation team staff transition and onboard new staff. And the final question in this section is a client scenario, along with questions about how the navigator will respond. Thank you so much. And now back to Lindsey.
Thanks, Angiela. In the final portion of this presentation, I will touch on the evaluation process. Earlier in the presentation, you heard them introduce the concept of Phase 1 and Phase 2 for the evaluation rubric within the funding process timeline. Phase 1 is based on general guidance with community volunteers and cross-functional United Way staff screening the applications. They will determine who moves into Phase 2. Phase 2 is a rubric evaluation of the application, an agency interview by regional volunteer teams that include community volunteers and cross-functional United Way staff. The evaluation rubrics looks at the strength of the application based on the agency's diversity, equity, inclusion, belonging, practices, or your approach, history, potential, and capacity to serve ALIS and BIPOC, the ability to collaborate, utilize CQI to improve programs and offer services through a strength-based coaching mindset that's pivotal to the integrated client journey. Simultaneously, we have organizational review volunteers reviewing the governance and financial health of the agency to determine their risk level, which will be factored into Phase 1 and Phase 2 portions of the evaluation. Now I'll pass it to Katherine von Haefen for the funding timeline and additional resources.
Thanks, Lindsey. My name is Katherine von Haefen, and I'm a manager for Mission and Strategy. I first want to share where to access and work on the application. You will access through our online portal called EC Impact, and you can see a link at the top of your screen. Please note, we have created a new instance, or in other words, a refresh portal for EC Impact. This means that all agencies, currently funded or not, will need to create a new profile. Pro tip is to create a bookmark for the EC Impact portal. And this is where you'll submit the Second Century Vision application. On the screen is a landing page for the new EC Impact portal. To set up your agency profile, click Create a new EC Impact account in the New to EC Impact section at the bottom of the landing page. Don't worry if you've never heard of or worked with EC Impact before. You will be provided with detailed instructions on how to log in and navigate this user-friendly system on our Second Century Vision webpage. As you create your profile, you must complete several screening questions to ensure your agency meets eligibility for the funding opportunity. If your agency does not meet eligibility requirements, you'll not be able to set up a profile. I know we provided you all with a lot of information this morning. The good news is that we're nearing the end of the presentation before we go into the question and answer section. However, we first want to provide everyone with a timeline, reminders, and additional resources that you may find helpful to you and your staff. On screen is an overview of the full funding process, so let's review the key dates. Today is April 6th, which is our funding conference, and technical assistance will occur throughout April and into May, and more on those in a bit. May 4th is the last day to early submit your application for feedback, and June 7th is the application due date. You will then be informed if your application will move forward to phase 2. Notifications will be communicated by the end of July. The final funding announcements will be made in January of 2022, and onboarding and new funding begins in spring of 2022. Lastly, I want to share additional resources that will be helpful as you work through the application. As Amanda mentioned at the beginning of our program, we have scheduled 5 sessions that we are calling technical assistance calls. These calls are for folks to ask questions regarding the application and our overall funding process. We will have at least 4 staff on hand at each session to answer any questions you may have. Please note that there is no set agenda on our end, so participants should be prepared with questions. The session dates and times are April 14th from 9 to 10 a.m., April 22nd from 3 to 4 p.m., April 27th from noon to 1, May 4th from 1 to 2 p.m., and finally, May 12th from 9 to 10 a.m. We ask that staff register for these sessions in advance by going onto our Second Century webpage on the United Way website. Secondly, Nonprofit Connections will be hosting 2 free grant writing sessions. Please note that these sessions will not go into specifics of the actual application, but instead provide a broad overview of general best practices. These sessions are scheduled for April 22nd from 11:30 to 1 p.m. and April 29th from 9 to 10:30 a.m. We ask everyone to pre-register for these sessions by going to our Second Century webpage on our website. As you can see and hear, many tools and resources are located on our Second Century Vision webpage, including the upskill modules, more information on Alice, the funding announcement, slide deck and recording of today's funding conference, the application and link to our EC Impact portal, frequently asked questions document, which we will be updating as we receive questions, a glossary of terms, an interactive regional profile dashboard, service definitions, our newly revised standards and policies, as well as the registration links for both technical assistance calls and nonprofit trainings. Please be sure to encourage staff who will be working on the application to visit this page for all the helpful resources. And that concludes our presentation. And now we'll begin to transition into the panel for questions. As we shift, please be sure you are submitting your questions in the Q&A box. And as a reminder, we have many participants on this call today and may not have a chance to answer every question. But as previously mentioned, we will provide other opportunities to ask your question. Now I'd like to introduce Dr. Angel Harris, Vice President and Chief Advancement Officer at United Way. Angel will be serving as our moderator for the panel session. Dr. Harris joined United Way of Greater Houston in January of 2021. She came to us previously serving as the Executive Director of Dress for Success in Columbus, Ohio. And prior to that role, Angel served as a Senior Vice President and Chief Development Officer at the United Way of Central Ohio. Dr. Harris was selected as Columbus's Small Nonprofit CEO of the Year in 2020. She also received the At the Table Community Excellence Award in 2020 and Buckeyes Lifestyle's Women of Initiative in 2019. We are so excited Angel has joined the United Way and is here with us today. Angel?
Thank you, Katherine. It's incredible to hear about the transformational change that's ahead. And I'm excited for what's to come as we move together into United Way's next 100 years of service. Before I introduce our panel, I want to thank everyone that has submitted questions through the Q&A box. I encourage folks to continue to submit your questions in the Q&A box, and staff are working behind the scenes to feed your questions to me. We have the next 30 to 40 minutes allocated for Q&A, and we will do our best to cover as many questions as possible. Please note that questions regarding specific agency programs will be addressed in the upcoming technical assistance calls. In other words, if your question is, will my after-school program that serves 20 young girls at Frostwood Elementary be a good fit? That question is best answered at our technical assistance calls. Now, let me introduce our esteemed panelists today. Margaret Oser is Vice President of Mission and Strategy and has been with the United Way of Greater Houston since 2013, and she came to us from United Way San Antonio. She spent her career in the nonprofit sector and a majority of that time serving within the United Way system. As VP of Mission and Strategy, Mo oversees United Way's investments, funding strategy, and community impact initiatives. Fun fact, before entering the nonprofit sector, Margaret worked for an entertainment promoter overseeing stadium events such as tractor pulls, motocross, and monster car relays. Go, Mo. I had no idea. Curtis McMinn is our next panelist, and he is the Senior Manager of Mission and Strategy. He leads a team that is responsible for United Way's community investments and supports funded partners with critical work, like assisting in the development of a culture of continuous quality improvement. Curtis holds a Master of Public Administration from the University of Texas at Arlington. Fun fact about Curtis is a woodworker and enjoys making furniture. Curtis, I want to see that latest piece that you've been working on. All right, are we ready to start?
Go.
All right. Well, our first question is from Margaret. And Margaret, this question comes from Annika Gorman, and it's been asked about 3 times. So the question is the $100,000 to $2 million funding available per organization the annual amount or the amount available over the 3-year grant period?
Thank you, Angel. So that's an easy one. The funding amount between $100K and $2 million is available per year during the 3-year funding cycle. So it would be each year of those 3 years that amount is available.
Perfect. Thank you so much. Our next question is for Curtis. And Curtis, this question comes to us from John Williford. Can United Way define services, and do services by your definition include programs, workshops, and trainings that do not provide medical treatment or medical care?
Well, thank you, John, for the question. What I would recommend is going to our website, unitedwayhouston.org/SCV, and under the resources section, you'll see later today posted the comprehensive list of eligible services. And in that document, we outline what we're looking to fund in each one of these investment categories. It's going to look different depending on the type of service that you're offering. So be sure to check that out. We will update that as time goes on and let you know when the updates are posted in the document.
Perfect. Thank you, Curtis. Our next question is from Margaret, and this is from an anonymous attendee. And the question is, our organization does not currently collect income information from clients, but the zip codes we serve are predominantly people living at 50% of AMI. Will this mean we cannot apply since we can't prove our individual clients are ALICE or in poverty?
So I would never say you cannot apply. Anyone can apply, but we will be looking to see that you are collecting individual income data. So if it's not something you currently do and it is possible to do, we would encourage you to come up with a system in order to collect that data. We will be looking to fund those programs and services that can actually document the household income of the people that they're serving.
Perfect. I appreciate that. Curtis, our next question comes from Mel Turnquist. Okay, so this question is about the navigators. So who provides the navigators, and are these United Way employees?
Thanks, Mel. So these are not United Way employees. By applying for a navigator, you're agreeing to either hire someone or repurpose someone to work full-time in this navigation role. So these are not United Way employees. They will be staff at your agency that you are hiring and providing that oversight to. And when you look at, I believe in one of the questions that's already been answered in the Q&A, we talk about the $100,000 for the navigation team, which does cover some of the costs of that staff, but also any of the kind of operation or management oversight of the navigation team.
Okay, thank you, Curtis. We appreciate that. Our next question is for Margaret, and this is from an anonymous attendee, and this is about fiscal sponsors. So the question is, if we have a fiscal sponsor that is also a nonprofit in our region wanting to apply, will this decrease the likelihood that either of us will be awarded money if we both apply?
At this point, I can't say it would decrease the likelihood as long as you're both applying independently and that you're doing distinct different programming. I would say that there shouldn't be a problem with that. It will just depend on the application and how well it fits with what we're looking for. But right now, if it's a fiscal sponsor and you both have a 501c3, that is key, then there should not be a problem.
Okay. The next question, Curtis, this one is for you, and it's about, applying jointly, organizations applying jointly. So can organizations send in a joint application and share the funds?
No, unfortunately, with this new change for United Way, we are wanting to fund individual agencies in an application through this process. So we know that many of you have great collaborations, partnerships that have worked together to apply for funding. But for this specific purpose, it's just a single agency per application.
Okay, thank you. Margaret, so the next question about board members is, how is board members who represent the local community defined?
That's a great question. So it is really defined by the local geographic area in which you serve. So I would be looking to what are the demographics and the characteristics of the community in which you serve, and is it represented on your board? We do not have a set pat definition of what that looks like, but we will be comparing your board representation to your client population and the overall community in which you're serving. What I will say is that we know boards are working towards this and not everybody is there yet. So we will be looking to see if you're not quite there yet, what is your plan to get there?
Okay, thank you. Our next question is for Curtis, and it comes from Shannon Cranston. Will preset collaborations be allowed to apply together?
No, Shannon. So just to the point I made earlier, it really is about the individual application for one agency. So we know that you'll want to collaborate and continue to collaborate. Our recommendation would be to have your collaborative partner, so long as they meet these requirements, submit an application as well.
Okay, thank you. Our next question And it's for Margaret, and it comes from Kelly King Jackson. How do community members get selected to the review committee?
Great question, Kelly. So right now we're in the recruitment phase, and we have our fingers crossed that we are going to have a dilemma of having too many people interested than we can actually use. But as of right now, we are recruiting within the various communities in which we are hoping to fund. And the main thing right now is we will be doing an interview process, and the primary part of that interview is to ensure that they're not bringing any particular bias to the process, either positive or negative. Other than that, the selection will be based on, do they reside in the communities in which we are going to be funding? And also, are they representative of the diverse cross-section of people who are stakeholders, as well as those who will be accessing services through this new model?
Awesome. Thank you. Curtis, our next question comes from Mel Turnquist. Will data collection tools be provided by United Way?
So, Mel, this is a question that has been asked by agencies since we first announced Second Century Vision. And we know it's on the top of the mind of everyone. How's United Way going to handle data? What kind of tools are we going to require? The approach we've taken is we're not wanting to have you add another data system to your network, right? Where you're having to create and add and edit documents or records again and again. The data trust that has been talked about in the presentation really is designed to pull from current systems. And there's a lot of work that goes into that. And so we're not imposing a new database that you're going to have to install on your systems. It really is designed to work with your current software packages.
Thanks, Curtis. Our next question is from Margaret, and it is from Literacy Volunteers. So if an organization is not awarded an investment, will they receive some type of feedback in order to help strengthen their application for future opportunities?
That is a great question. And I will be honest with you, it's one that we constantly grapple with about what we can provide an organization if funding is not awarded. I will tell you, we anticipate this process being highly competitive with numerous applications, far more than we will be able to fund in the end. So we will not be able to give individual feedback to every organization, but what we will be providing if you're not funded is continual support through the education training, support through our nonprofit connection. And we are always going to be looking for additional organizations that are willing to partner with us in this work. So I would say, don't be disheartened if you are not awarded funding this time. It's not because the services weren't valuable. It would be just because we just do not have the resources to invest in everything that we would like to.
Okay. I appreciate that. And so I have a few questions for Curtis. And the first one is from an anonymous attendee. Is the upload platform HIPAA compliant for those of us that provide healthcare assistance?
Yes. Actually, when we worked on identifying a vendor and a company to work with, we specifically focused on privacy laws, HIPAA, and so forth. We know that many of you are, you are tasked with through your accreditations and your own funding sources and just the nature of your work to really be careful with the data and mindful of sharing client data. And so this process absolutely respects those privacy laws.
Okay. So Curtis, now what about agencies that can't share client identifying data due to attorney-client privilege and similar issues?
Yeah, it's the same thing. So we really want to make sure that agencies that have that kind of restriction placed upon them, that the system operates and allows them to contribute and be part of it. So be on the lookout for the additional details. But this was a key concern expressed to us at the very beginning, and it has been on the absolute top of the mind of the staff and the volunteers as we've picked out this data trust in the system.
Perfect. Okay, my next question is, do you need to have, and this is for Curtis, do you need to have office space in each region, or can you just provide services for clients from that region?
Yeah, so you really need to be intentional about where you're serving in that region. We know that everyone has clients coming in from all across the regions. That's not what we are looking for. So you need to have a physical presence, whether it is a office there, or that you are co-locating services, or that you are hoteling services. You have access to space where individuals in that community can come in and access services. So we're quite flexible there, but it just cannot be clients coming from an area to where you are located as you serving their origin point.
Okay. Another question, Curtis, about location. Are home-based offices to be counted as presence in the qualified region, or must it be the nonprofit primary building structure address?
Yeah, unless you're seeing clients in your kitchen, right? The home-based office does not count as serving them, right? And so it really is about where you're able to have clients come in and access services. And again, it can be in a church, it could be in a community center, it could be in the physical building that you have rented out or that you've purchased, but it has to be a place where they can go to access services.
Okay. Thank you for that. Margaret, my next question comes to you from Astrid Salarda, and it is, if nonprofits are not funded this year, will there be an opportunity to apply again next year?
Thank you for the question, Astrid. I wish I could tell you that we will have open funding available next year, but we will be running this funding process every 3 years. What we will have available is what we're calling our Strategic Opportunity Fund, and that is a flexible funding category where we are looking to fund things that are highly innovative, brand new, that could really propel the work forward, that are catalytic in our systems level. And so there will be those opportunities. It'll be far more flexible and throughout the 3 years. But in terms of a formal funding process such as this, we will be running it once every 3 years.
Okay. Thank you for that clarification. Curtis, I have a few questions for you. And the first one comes from Kayla Hand. And she says, hello. All of our population meets your income threshold, but many are not employed. So they're technically not Alice. Is that okay?
Yes. Yes, it is. It is okay.
Okay. And then from an anonymous attendee regarding the navigation team, can we request funding for 2 regions navigation team, like up to $200,000, where the team works in concert with one another to provide services in both counties?
Yeah, so we are expecting all of the navigators to work across board in a team, right? So there's going to be a lot of connection between navigators who are going to be funded in different organizations. So you may apply for up to the 2 navigators to serve a respective regions, right? And so it absolutely is appropriate to do so.
Okay, thank you. And so Nadine has a clarification question, Curtis. So are you saying that an agency must have a physical presence within a region in order to apply for funding within that region?
Yeah, so you need to have a place where like you're seeing clients or accessing clients. And we know that there's going to be some difficulty or challenges with that. What we recommend is we can talk specifics about your unique services in the QA, in the technical assistance calls.
Okay. That sounds great. There's a few questions here from Nadine, and I think that might be helpful to be
Hi,
able to address
Nadine.
those there. And Curtis, our next question comes from Laura Somerville. If you early submit for feedback, is there a chance to edit, incorporate the feedback before a final submission?
Absolutely. That's what we're hoping. All right. So we wanted to offer this opportunity where any interested agency could submit the application early by May 4th, and then our team will take a look at it, provide some high-level feedback as to what we see, and then the application opens up again for you to make edits before it's due on June 7th. So we want to give you that time to be able to respond and not have it, your feedback come to you June 6th, right? So that's why it's early May, so that you're going to have time to adjust your application with the feedback that we've given.
Okay. Curtis, our next question comes from Kathy Moore. Will we be required to share personally identifying information for our clients supported with this grant?
Yeah, so this goes back to the data piece, and Kathy, I'll tell you the same thing, that we're really focused on appreciating client confidentiality and respecting those laws and regulations. So be on the lookout for additional details, but that is at the forefront of what we're wanting to make sure happens. We're not wanting to put any organization at risk, expose you for any issues. So just trust us. It is part of this data trust and the platform we're using.
Perfect. Margaret, my next question is for you, and this is around service centers. So are the United Way service centers being folded into this model?
Their funding model, yes, it is. We are still looking to have geographic locations within our outlying areas. And in fact, we're looking to see how we can broaden that. But in terms of the funding within each of those areas, that is part of the 13 region focus. And so all funding will be folded into this one process.
Okay, great. Margaret, so we have an anonymous attendee that is asking, can we submit by the early deadline to get feedback, even if we know we're working on meeting some of the factors by later than the June deadline, such as insurance, et cetera?
Yes, they can definitely submit early to get feedback as long as they can meet all the requirements by the deadline, but that does not mean they cannot submit early to get the feedback on their written application. We would be happy to review it and provide that feedback.
Okay, perfect. And Margaret, the next question comes from Mercedes. When you say that funding is not guaranteed in a multi-year grant, do you mean that we are only assured of the first year of funding, but the other 2 years should not be booked as a pledge?
Thank you, Mercedes. That's a great question. And it's good, especially for those that are not used to our funding, to clarify how our funding works. So the intent is the funding would be for 3 years, but we only commit the funding per year on an annual basis because we have to take into account what we raise in our community campaign. That's the primary vehicle for our investments. And it can go up and it can go down. And we always need to have the flexibility to adjust our investments based on what we are able to raise during the community campaign. So what you will get if you are awarded funding is an agreement for 1 year with the understanding that as long as performance continues and the resources are available, the funding will continue, but it will not be a commitment except for annually. And then each year you'll get a new agreement with that new funding amount.
Thanks, Mo. So this next question is, when pursuing collaborations or reporting collaborations, is there a requirement or minimum of collaborations with United Way affiliates versus non-United Way affiliates and nonprofit versus for-profit? And so that question is for Margaret. Curtis.
Is it for me or for Curtis?
It's for Curtis.
Okay. No, there isn't we're not looking for a specific formula to say to United Way funded agencies and one non-funded. It really isn't about that. So do not worry about having to have a mix of collaborations that are funded by United Way.
Okay, thank you for that. Now I'm back to you, Margaret, from an anonymous attendee. I see that an independent financial audit or statement of review is required for organizational review. Does the audit or review need to be completed by the application due date, or can we undergo the review after we know if we proceed to phase 2?
So that is a great question. Unfortunately, we will be doing the organizational review during the first phase of the application. So we would need to receive the audit or the review by the time of application in June.
Okay, thank you for that. Curtis, our next question comes from Christina Allen. Is collaboration encouraged with other agencies regardless of the length of time they have been a 501c3?
Yes, yeah, absolutely. We would encourage that. We know that you have many collaborative partners that perhaps are not going to be a fit for Second Century Vision, but serve a critical need for your clients. We absolutely would encourage you to continue working with them, even though they may not meet any of the requirements that we have outlined here, particularly as it relates to that 501c3 status, that timeline.
Okay. And Curtis, this next question is from an anonymous attendee. What if we know that our customers are currently enrolled in SNAP? Would that be enough information regarding income?
Yeah, so I think that what is, we have the qualifying for ALICE document that will outline how to calculate and what we mean by ALICE. And so I would reference that to look at what it means, what's acceptable to document that an individual is ALICE.
Okay, thank you. And Curtis, this next question comes from Astrid. If nonprofits do not formally track household income data, would we have to implement a new measure, or could we rely on a partner organization as part of the collaboration and delivery of integrated services?
So this starts getting pretty technical, right, in terms of where you're receiving the referrals. What we'd say is the guidance is the same. If you are not currently collecting individual income information on your clients, it's really not meeting the expectations we have for the funding, right? So you would have to implement a new measure to be able to collect that information. And there are the upskill modules that explain more about ALICE that are available to you. But it really is something that you would need to consider adding to be eligible for this funding.
Okay, great. Margaret, I have a two-part question from you coming from Kara. How will you rationalize funding for strategic opportunities with a 1-year commitment versus funding broader client journey and safety net for a 3-year commitment? So that's kind of part one. And then part two is, how will strategic opportunities such as pilots be managed if they show promise to continue support and possibly move into a 3-year commitment?
Great question, Kara. In terms of the Strategic Opportunity Fund, those will be funded on an annual basis, but I will tell you, the intent is not to be a one and done. We fund you 1 year and then we're out, we're moving on to the next one. It really is showing promise, it's really developing and growing into something that we were hoping it would. We intend to find ways to continue to support that growth and that project, pilot, etc. At some point, our hope would be that it could then move into the more regular 3-year funding process. But the Strategic Opportunity Fund is that place to give it that space to kind of grow, get its feet, and move forward.
Okay, thank you. And Margaret, so another question coming from Janita Jones. Are preventative or post-crisis recovery services eligible?
Thank you, Janita. I would say, again, go back to the document that Curtis has referenced several times. that really delineates all the different services that we will be investing in, and that will give you more clarity on all the different types of services that are eligible.
Okay. And Margaret, Kelly Young is asking, will there be a metric for determining financial health?
Great question, Kelly. So one of the things that we are going to be fleshing all the way out are all the different metrics that will roll up into financial health. So yes, we will be working on that. I can tell you through our work through the Thrive Collaborative, we already have quite a few that we use to determine that. And one of the things that we will be working on is to see how we can reduce that number, because I will tell you it is quite numerous at this point. To alleviate some of the data tracking we currently are asking those partners to do, so that it's more, so it's easier for all of our partners moving forward to be able to track the financial health.
Okay.
But stay tuned.
Perfect. Thanks, Margaret. We're going to try and power through these next few questions to make sure we can get as many in as possible. So, Curtis, would the Navigator funds be eligible to be used as match funds for AmeriCorps members whose responsibilities will fall within the definition of the Navigator role?
So that's a great question. I will tell you, we're expecting this. My first answer is no. We're expecting this to be a full-time role, right? And for the navigators to work together as part of Second Century Vision. So we're expecting them to focus on those things. We understand that sometimes AmeriCorps also has other work that would be a full-time role. So it really needs to align with the purpose and the function of the navigator. I don't necessarily know at this time off the top of my head that AmeriCorps would be the best role, that would be the best use of those funds.
Okay. And Curtis, could a portion of the funds be used to make building improvements? Could you speak a little bit about the budget template?
Yeah, so there's some flexibility in how to utilize our dollars. In the budget, you can outline what how you're wanting to utilize those dollars. But again, we really want to see the results from the services. So if you need to utilize some of the resources to make a small improvement to the building or what have you, then that could be an eligible use for the funding. We understand many of you may want to take advantage of that. That's totally fine. And as part of the application, you can provide some details there.
Okay. And so, Margaret, our next question is from Tiff Burrell. Is having a local advisory council acceptable? We have a statewide board, but a local advisory council.
Okay, thank you, Tiff. So a local advisory council is acceptable if they have decision-making authority for your local organization. What we're not really looking to invest in are statewide boards that make all the programming and budgetary decisions for the local. If your local advisory council does have that authority and then it flows to the statewide, that would be acceptable. But they really need to be local and making decisions locally.
Okay, thank you. And Jennifer Sampson has our next question, and it is, I understand the funding for a navigation team, but is there general operation funding?
So that's the golden goose, right? General operating funding. We truly, truly wish we could tell you that's what we have. Although our funding is flexible, you can use some of it to help cover some of those costs. The funding really is to make sure these services are being delivered in the community. What I will say, though, is that it doesn't mean you can't put some of those costs into this and utilize our funding to help cover some of that. As long as we see the results that we're looking for, that is okay.
Okay. And Margaret, can you explain what you're looking for with the DEI plan?
I will tell you with the DEI plan, we do not have a specific thing in which we are looking. We are looking to ensure that what your organization's plan is reflective of the community in which you're serving, and that it's removing systemic barriers and blocks to people moving forward in their own lives and in our community. That's the genesis of our plan. And so what we're looking from each organization is, how does that play out within your organization and the work that you're doing within the community?
Thank you. Margaret, our next question is from Vivian Bush. If you want your program to provide a service that is provided by another agency, can you use grant funding to pay the other agency as a vendor on a fee-for-service basis and count those services as part of your program?
That's a great question, Vivian, and I don't know if I have a direct answer yet. I know we are not looking to sub grantees. That's not really something we're looking to do. However, I know that there are some types of programming where organizations come in and provide an additional service to the services that you're providing. I would recommend working with that group in both submitting applications for the funding as opposed to one submitting to do sub-grants to another organization. That's how I would recommend handling something like that at this moment.
But they could also talk with us in the technical assistance calls, and we may be able to better understand the specifics. Yeah.
Okay. Well, Curtis, question from an anonymous attendee. How should we let community members know how to apply to serve on your selection committee?
So that's great. We really want to get the message out about the volunteer opportunity. We're expecting to post additional details of that on our website here, over the next couple weeks or so. So we, stay up to date on that Second Century Vision website. Please bookmark it, set it as your homepage, whatever you got to do, because we're going to be updating it regularly. We would encourage you to, once that information's out there, to share it with your networks far and wide.
Okay. And Curtis, what if your services to a region are virtual, like telehealth?
Yeah, I think that we would want to talk with you in the technical assistance. If you could talk with us more about the specifics of your service, we'd be happy to really think through and figure out whether or not it qualifies for serving within a region. We know that United Way is the same way. Our model's been upended, right, by COVID, and we're all working remotely. So we understand that there are some service changes that way. So talk with us about it, and we will hash out those details. And of course, we will continue to update the frequently asked questions document with this information. So in case you miss it, you can follow along.
Okay, thanks, Mary, for that question. And Curtis, the next one comes from Leah from Fort Bend Seniors Meals on Wheels. If you apply for Navigator funding, is the Navigator team serving just that agency's clients or expected to serve all clients at any United Way funded agency?
Yeah, so it really is about being part of this connected Second Century Vision system, ensuring that integrated client journey happens. It's not an agency-specific service, right? So we're expecting to have, one or two navigators a region, depending on the population. So you would be choosing to be that navigator for the region, servicing clients from across organizations.
Okay. And Curtis, the next question comes from an anonymous attendee. We report aggregate outcomes and outputs rather than reporting at an individual level. Is there an expectation that common metrics need to be at the individual level and accessible with income and other demographic cross filters?
That's a great question. So we will have our common metrics posted on the website here in a little while, and you'll see there that it is more of an aggregate approach to data collection for the common metrics. particularly as it relates to what we call the service metrics. Now, when it comes to the integrated client journey metrics, we are wanting to track progress along an individual's journey. And so we would want to be able to know how people are progressing or whether they are progressing for those metrics. So it's a bit of a combination of both.
Okay, thank you. And my last question is for Margaret, and this is from an anonymous attendee. The investment strategy for services are determined by region. Will there be estimates of the funding per region to assist applicants in determining the funding request amount? It is sometimes easier to create budgets when we have more concrete guidelines.
Thank you. Yes, we are fully aware that it is much easier to come up with what you're asking for when you know what we actually have to invest in each region. Unfortunately, as we've stated earlier, we have to wait for at least preliminary projections on what our funding, our annual campaign will raise. And that fundraising effort doesn't kick off till this summer. So we really won't have good estimates until the fall of what we have to invest. So we ask you to use all the information that you can based on the regions, the density within the regions, the type of service that you're going to be applying for, that matrix that we showed earlier in the presentation about the percentage that we'll be looking to invest in each service. So I really do wish I could give you a concrete, this is how much is going to go into each region, but we just won't have those numbers till later in the year.
Okay. Thank you for sharing that. And thank you to each one of our participants for the great questions. A huge thank you to both Margaret Curtis and all the presenters throughout the funding conference. Thank you all so much. Now, I would like to turn the program back to Amanda McMillian, President and CEO of United Way of Greater Houston.
Thank you, Angel. And Margaret and Curtis, thank you so much for fielding the Q&A session. I know that many of you had questions we couldn't quite get to this morning. Really appreciate all of your questions. We will be updating our FAQ page regularly throughout our funding process. So definitely please check back on our website for updated FAQs over time. I'd also, like Angel, like to thank all the United Way staff and volunteers who worked so hard to make this event possible. Today is an exciting step on implementing our new vision and funding strategy. We are really looking forward to partnering with so many of you nonprofits under Second Century Vision so that collectively we can work together and improve outcomes for the ALICE population all across Greater Houston. I do want to provide everyone with a couple of final reminders. The resources and tools mentioned today are available on our Second Century page on the United Way's website. And we know that in addition to today's questions, you'll have additional questions as you work on the application. So please don't forget to register for the upcoming technical assistance calls and the free nonprofit connection sessions on grant writing. Registration links for those can be accessed by visiting our Second Century page on the United Way website, which again is unitedwayhouston.org/SCV. And if those registration links aren't up yet, we'll make sure that they're up there shortly. On behalf of the staff and United Way Board of Trustees, thank you for joining us today and for the work that each of you do every day to serve individuals and families across our community. Have a great day.